Next thing we're going to talk about is the eye trauma protocol. Obviously, the indications for this are going to be an injury to the eye or the periorbital region, which is just the region around the eye. There's not really any contraindications to this per se. If an open globe is suspected, do not palpate the eye or the surrounding region. Assess the visual acuity of the patient. Cover with an eye shield, not a patch. They're different. Make sure the eye shield is resting on the orbital ridge. Stabilize large penetrating foreign objects without applying pressure to the globe. So use bulky dressings, like gauze to stabilize it. I've also seen styrofoam cups used. That way you can kind of stabilize it with that. Transport with the head elevated if able. Aggressively treat nausea and pain per protocol. Assess the mental status and nerve function. Assess visual acuity every 10 minutes in the affected eye. Assess extraocular movements. If safe, allow the patient to sit upright during transport. And again, treat pain or nausea per protocol. If there is a foreign body embedded in the eye and is visible, gentle irrigation with saline may remove the body, or you may also gently dab a foreign body off the cornea with a moist cotton swab. Avoid patching the eye in this instance. If it is a chemical exposure and you irrigate you need to irrigate the eye, irrigate it on scene with water or saline for at least 20 minutes. You can use an eye wash station, running tap water, or irrigation with a IV crystalloid solution such as saline or LR may be usable. Paramedics, you can use a Morgan lens with continuous irrigation to allow transport with irrigation. However, you want to irrigate for at least 20 minutes before you go, just that way so you don't get whatever chemical in their eyes in your truck. If your service carries tetracaine or proparacaine, you can do 1 to 2 drops per eye. This may help facilitate irrigation and Morgan lens placement. And again, don't begin transport until you've irrigated for at least 20 minutes or no ability to further irrigate exists. If it's a thermal burn, just deploy a moist gauze to the burn area. If it's a laceration to the eye, cover with moist gauze and avoid putting pressure on the eye, given the possibility of an open globe.